Now that I have my own tooth issues, brings me into the situation of a patient. And age-old question: do I have to do what the doctor recommends? It's always a very difficult question because you don't have the knowledge, but you also don't know why the doctor recommends it. I saw a dentist who my wife saw since she was a little kid. She trusts him, and I trust him too. He said I had periodontitis, inflammation or infection of the gum. I had pockets. That I already knew. It seems like it got infected. That makes sense. It hurt a lot. It feels better. Says you need to treat it. I agree. He put in some local antibiotics and then said you should use mouth rinse for hexane, which I could have presumed. But beyond that, he gave steroids and oral antibiotics, and I'm not sure I want those. Not sure I need those. And I think that's the difficulty when it comes to being a patient. You don't know as much as a doctor the vast majority of the time. You can look stuff up, but still, you don't have the background necessary to understand everything. What do? You just trust them? They want the best for you, but what does that mean? What is the risk of it getting worse if I don't take any pills and just do good local care versus the risk of taking antibiotics and steroids for a short period of time? There's a long-term difference and a short-term difference. Another thing is to make you feel better, sometimes they do stuff. And you may say, I could just suck it up, get through it by myself, it's okay. But not everybody's like that. For example, my fingers. They don't look so bad right now, but they were pretty bad, pretty swollen. My friend, who's a dermatologist, thinks it's dyshydrotic eczema, which I thought it was too, which doesn't make the most sense to me because, I'm in a place that's very moist and humid. And what does dyshydrotic eczema mean anyways? Because eczema is usually a dry condition. Either way, he recommends some steroids, and I did it. I was debating whether or not I need steroids. What is the risk of taking steroids? Well, it's orally usually talk about the risk. Putting on your skin, not much risk. Preferred, doesn't get absorbed really. Do I need to get better? I read that it'll get better by itself anyways, just takes longer. It's very itchy. Should I just try to bear it? Should I give myself some steroids with this minimally low risk? Should I just do what's recommended? But all these questions, all these things require knowledge about the patient's preference as well, which the doctor doesn't have. Their pain tolerance, waiting time.